New COVID prediction models show 100 million Americans will catch a new but less dangerous strain of COVID this fall and winter. Hello, everybody. I'm Heather Hayes.
And I'm Steve Eager. This new wave is not expected to be as brutal as the Omicron surge in December and January, but scientists predict many people who have been vaccinated or who have already had COVID will be reinfected. Fox 4's Alex Boyer is at a Dallas COVID testing site near downtown. Alex.
Yeah, guys, and I can tell you there's no line or waiting here at this COVID testing site. The technician tells me they've seen about a half a dozen people here today, but that doesn't mean that folks aren't getting tested. Experts say that more people are now doing at-home tests. The problem with that is that a growing number of people who may be testing positive for COVID-19, those cases are going unreported to public health departments. That is why some medical experts believe that a surge is already here. Just as many Americans are beginning to find their stride again, medical experts say another COVID-19 surge is imminent.
In some ways, we are already in the midst of a surge. In the last 3 weeks, deaths have plateaued and cases are starting to rise again.
During a virtual media briefing hosted by the Johns Hopkins Bloomberg School of Public Health Tuesday, epidemiologists say the latest wave could infect an estimated 100 million Americans by next fall and winter. The silver lining, this subvariant appears to produce milder symptoms, particularly in those people who are vaccinated and boosted.
In some ways, this is encouraging in that we're starting to see a divergence between the number of cases and the number of hospitalizations and deaths.
Research shows 1/3 of Americans who get infected suffer long COVID, symptoms persisting for over 3 months.
And it's not yet clear who is at greatest risk for these particular disability issues.
I think we are concerned about a summer surge for a variety of reasons.
Dr. Mark Casanova is a member of the Texas Medical Society COVID-19 Task Force. He says those folks who are fully vaccinated and boosted have done all they can to try and stay healthy.
For the unvaccinated, it is still really a roll of the dice.
Dr. Casanova is also worried about people traveling this summer, with masks now optional on virtually all mass transit.
It would certainly remain our recommendation and strong encouragement that in those tight quarters, individuals remain masked. It's just simply the smart thing to do.
Passengers we spoke to at Love Field divided on that recommendation.
We don't really want to get it again, so we're probably low risk, but why not?
I think it should definitely be personal preference. If you want to protect yourself, wear your mask.
To me, wearing a mask doesn't make any sense.
And we learned at that media briefing today that Moderna is in the process of developing a new vaccine that will target both the original strain of COVID-19 as well as some of these newer variants. However, that new vaccine will not be available for several months.